Alrighty, welcome back to Kearsarge Valley Magazine. I am Adam Brisbine, and I am here at Coppola Physical Therapy, and we are here with Dr. Steve Coppola, and we're going to talk about probably something my grandmother would like to watch, something about posture and neutral spine.
Yeah.
Obviously, everybody's got that. Grandma was always correcting him and stuff like that. You're actually going to explain to us what the neutral spine actually is and how we can benefit from it.
That's true, and it's important to note that 8 out of 10 people that are probably watching today actually have had back pain in their life.
Sure.
I mean, 8 out of 10. And most people come to physical therapy and they say, is this going to happen to me again? And I'll go, you know what, you get an 8 times greater likelihood of once you have back pain of it coming back. So that's why it's an important topic and why I'm here today to talk about it. But I have a concept that really takes that 8 times greater likelihood of recurrence and brings it down to really 1 or 2 times greater likelihood. And that's kind of what I want to share with you.
Okay.
If we look at a spine here, you'll see that a spine kind of has some curves. And it's kind of an S curve, okay? In our low back it curves one way, our mid back it curves another, and then in our neck it curves another way there. So it's important that this is the way that we're supposed to have that. You know, a lot of people can get very, are we supposed to have this curve? If it's a curve going side to side, and that's really scoliosis, and that's not something that's normal, but we're actually supposed to have a normal curve going front to back. So it's important that we have 3, and that's called a neutral spine, and that's very important. The reason why it's important is because we want to maintain that neutral spine with everything we do, and that happens for 2 reasons. The first reason why is that if I have a neutral spine, if I don't have a neutral spine, I bend over at the waist, and I keep doing that. You think of a coat hanger. If I take a coat hanger and I bend it, does it break? How about the second time? Yeah. How about the third? How about the fourth? That's right. And then when it finally breaks, you know, number 150 times, you know, it doesn't take much at all. And I have people come into my office all the time, and I just bent over to brush my teeth, or I just bent over to pick up my shoes, and I go, was that really why it happened, or was it just a repetition, right, over and over again? So it's important, if you maintain that neutral spine, you're actually preserving your discs, and you're actually not putting a lot of pressure on them so that you're not getting that coat hanger effect. And the second thing is really a muscular component. If I take your bicep here and I say, no, don't let me pull this down, don't let me pull down, don't let me pull down, and you're really strong there. But then I take your elbow and I extend it out here, your bicep muscle is now extended, and I say, now don't let me push this down, don't let me push it down. It's more difficult for you. Why? Well, because here your muscle's in mid-length, and in mid-length your muscle's strong. When your muscle is elongated, it's not as strong. Well, guess what? In our spine, same thing. And when we're in neutral spine, it's when our muscles are the strongest. Our back muscles are working for us instead of against us. When you bend over at the waist, those muscles are elongated. They're not able to work. That's right, exactly. So I'm here to talk a bit about whatever we do. You can take this concept everywhere with whatever you do is that neutral spine. Neutral spine looks a little, you know, you look a little J-Lo'd, you know, that J. Lopez butt sticking out a little bit to kind of accentuate it. Maybe I'm making a little bit more. Shoulders pointed up towards heaven. You never know when you're going to go. And then this is kind of, you know, what you're going to do when you lift. Maintain that with whatever you do. Okay?
Perfect. So it's more of a philosophy in terms of your life rather than just some medical thing. If you practice this, you will cut down on your pain. You'll stabilize your body and correct a lot of different things.
Yeah, I'm asked to go into companies all the time and take a look how they do this or how this person does that. And I teach this philosophy, and I go, now I hand you the gauntlet, and you go out there and you now look and go, what can you be doing and what are you doing right? And once they understand neutral spine and how to maintain that and why to maintain that, it literally changes the amount of times I have to go out to companies.
So let's talk about the one thing that people injure themselves most with, lifting things.
Yeah.
What is the proper way to actually lift something? Why don't we talk about that?
All right. Well, we have a box here that we can kind of use. It's important to have a firm footing. Okay. And keep yourself maybe your legs probably shoulder width apart. And when you squat down, it's important. Use your knees and not at the waist. Remember, I said J-Lo yourself.
You hear that all the time. Use your knees, not your waist.
Bend with your knees. Absolutely. And so you're going to bend with me as I go down here. All right. We're going to go down, and you notice how close I keep this load. Okay. Because 10 pounds close to me, is 100 pounds if my arm's out. So I keep that load nice and close and keep it in. A lot of times people like to get their legs in the way there, but you want to keep that load nice and close.
Okay.
My back is straight. I actually have J-load myself a little bit, as I said. My shoulders are pointed up towards heaven. They're not pointed that way. And now I'm going to be a straight lift up, okay? Using those back muscles, tightening my stomach. You know, that's kind of bringing your belly button in towards your back. And it's a straight lift up.
Okay.
Perfectly.
Perfect.
Okay?
Yeah.
Life is not a box. I realize that. But if you can maintain that concept, you're going to be safe with it.
And it's one of those things where it may not hurt when you're lifting something now. If you're lifting anything, it may not hurt when you're lifting at the waist. But you're talking about down the line when you go to bend over that toothbrush. Because you did it the wrong way, you're going to get that pain.
It could go both ways, absolutely. But most of the time, right, only 10 to 20% of the time is there a recognizable cause to back pain, which means 80% of the time it's not. So it's important, again, it's not just up and down, it's still twisting. Don't twist at the waist. That's not a neutral spine, right? So it's the same concept for everything.
All right, so keep yourself J-load.
J-load.
That's an official term. Doctor, thank you for joining us. If somebody wants some more information about this, how can they contact you?
They can give us a call at 228-7500 or www.coppolapt.com.
Okay.
Yeah, that's COPPOLA PT.com. Sure.
All righty, well, thanks for joining us.
Thanks for having me.
Back to you.